as well. We've got some nutritional supplements here that I can talk to you about. So speech language therapists basically assess a patient's swallow to say what kind of texture or thickness of fluid that they're most able to tolerate. By tolerate we mean not aspirate. So if somebody with an unsafe swallow was to have, let's say, like a normal glass of water, instead of them being able to control it and it going into their stomach, they might aspirate and it could go onto their lungs, which again can lead to like a chest infection and make them very
So it's just when it goes the wrong way.
Yeah.
Kind of similar to like when you drink water too fast and you start coughing and splurting. So at least we can do that and it clears it, doesn't it?
Yes.
So
whereas another patient they may not have that.
Yeah.
So speech language therapists basically tell us the right texture and the right thickness of fluid, which we kind of compare to one of the standards that we have, which is called INSEE, which is fairly new. And we have all these different nutritional supplements. We have some of them that are very thin and quite normal for patients to have. We have other ones which are more like a moussey kind of texture, which means that patients can have those, and also ones that are slightly thicker than normal, but then still kind of help them to meet their nutritional requirements even if they haven't got any swallowing difficulties.
And what is actually in these supplements?
So they are high calorie, high protein, essentially nutritional supplements. This one basically tastes like a custard, and they've got lots of vitamins and minerals in them as well. This one, so 40 gram. So in the hospital we have nutritional supplements. So this one basically tastes like a custard. This one is called Nutritional, and it's basically like quite a thick milkshake as well. And this one's 40 sip, which is again similar to this one, but slightly thinner milkshake. Essentially.
We've got some powdered fresh milkshakes as well. I feel like the younger patients like these a bit more.
Yeah.
Yeah, definitely.
These ones, some patients can kind of compare these to a McDonald's milkshake.
Yeah.
Essentially.
That's why I like them.
So you can get these on the ward. My personal opinion is that I prefer these because obviously we do kind of practice what we preach. We have to try everything.
Have to try them.
Including the NG tube as well. So I've had an NG tube placed to see what it felt like. I didn't actually enjoy the experience, but at the end of the day, if I knew that I needed one, it would kind of outweigh those awful feelings.
They're not having
any nutrition. Yeah. Sorry, back to this. So, I feel as though younger patients do kind of prefer these, or patients who have been on these for ages find that these taste a bit more fresh because they are mixed with kind of milk on the ward as well.
Yeah.
Patients who don't really like milky drinks, we also have savoury soups as well, which are also quite nice. Again, they have quite high calorie, high protein in them, and they're made up with water, just like a normal cup of soup that you would do normally, but it's just a bit more nutritious for you.
And of course, when they go home, we would give them advice. They might not be using these products, but might be using other foods to fortify foods as well.
Yeah, definitely. So sometimes we send patients home on supplements if we think they really need them. Other times we do usually do the food first approach to make sure that we're kind of not medicalising something like their eating and drinking if we think they can kind of meet their nutritional requirements. So whether that's more milky puddings, more high calorie, high protein based snacks as well.
Yeah, that's always our approach, isn't it? Every time we see a patient, we try and get them back to what's near normal as possible. So when they go home, I usually get them to probably encourage them to eat a bit more, definitely.